Hello, everyone. Welcome to the 2019 Brain Health Online Summit. I am Amy Zelmer, founder of Faces of TBI, and myself, along with Dr. Jeremy Schmo from Midwest Functional Neurology Center, we saw a need in the brain injury community for more training and education on alternative healthcare methods and modalities for those suffering from the long-term effects of a brain injury. So each week during the summit, you are going to hear from a presenter who will share either their real life experience living with a brain injury or working with brain injury patients. And today I am here with Dr. Erik Reis, and Dr. Reis is a doctor of chiropractic and board certified chiropractic neurologist at Midwest Functional Neurology Center. He received his doctorate in chiropractic from Northwestern Health Sciences University, graduating with magna cum laude honors, and graduated from the University of Minnesota with his Bachelor of Science degree in kinesiology and exercise science with an emphasis in athletic performance. He currently holds a diplomate in neurology from the American Chiropractic Neurology Board through the American Chiropractic Association. Dr. Reis believes the connection between structure, neurological function, and nutritional status is essential to understanding how to fully maximize brain function and overall health, which is why he takes a multifaceted and comprehensive integrative health approach to improving the brain health and overall wellness of his patients. So welcome to the summit, Dr. Reis. So happy
Thanks,
to have
Amy.
you here.
I'm excited to be here. I think this is an amazing opportunity to educate and to show others that they're not broken. There is hope out there for whatever situation they're placed in. So I'm excited to be here. Thanks for having me.
Absolutely. And today we're going to be talking about headaches and why me? Why
Yes.
do I have a headache? And
Yes.
I know just in my own personal experience, I had a 24/7 headache when I fell and hit my head. And it's probably the most common complaint I hear about within my community. And, I think headaches are so misunderstood. They're very complex and mysterious. So I'm very excited to have you here today and just kind of take us through your approach.
Yeah. Well, and I'm glad you mentioned that because they really are a very common thing that a lot of people deal with, whether or not they've actually ever had a brain injury. 1 in 4 women at some point in their life are going to have a migraine. And we know that headaches are one of the most debilitating conditions out there, not only for missed work days, but affecting quality of life, allowing people to do the things that they want to do throughout the day. And you are right, they are complex. No headache is alike any other headache that anyone else ever has. And I align with this on a daily basis with the patients that come into our office because, everybody's gone and they've seen all of these specialists and these different types of doctors. And they kind of get these cookie cutter approaches to trying to treat their condition. And it's so inappropriate because every single headache is different. Every single person's brain is different. So we have to take an individualized approach and really understand what's going on with these conditions. One of the most important things that we need to understand is just how the brain functions in general. And I talk with patients through educating and having these conversations about their health and what's going on. More importantly, what isn't going on. Your brain is a big computer, and it's always taking in information. All of these senses that you have are what really drive brain function. But with that being said, you have inputs, you have some sort of computational process, and you have outputs. And sometimes the inputs don't match the outputs. Sometimes you have things telling you inappropriate information to the brain. The brain has no idea what's going on and gives you the output that just it's the best algorithm that it has. And that analogy is a little bit more relevant when we kind of take a look at the brain and when we're looking at 3 major players in the brain and in your sensory systems that are giving you information are your eyes, your muscles and joints, specifically of the neck and the head in humans. Those are the highest density of inputs into the brain. And then along with that too is your inner ear. And your inner ear is that system that becomes active on elevators and escalators that lets you know you're moving, even though you may not physically be moving. And so those 3 systems are kind of like the 3 friends that go to the same party. They should tell you the same story. And when they don't tell you the same story, who do you believe? Right? Well, between you and I, we would always say, well, we're going to believe our best friend because we know they never lie to us, but the brain doesn't have that luxury. So some people are just stuck with this altered perception of their reality, and that can manifest whether it's dizziness, whether it's migraines, whether it is neck pain, whether it's a feeling of disconnect, cognitive dissonance. There's an array of symptoms. And so headaches can be a part of an array or a cascade of symptoms that these people may be dealing with. And a lot of them, most of them that make their way into our office, have seen a lot of these other providers. And that's not saying that we're better than anybody. It's just our approach is so different. And we need to be different
Right.
with the way that we approach these conditions because statistically and from a historical perspective, we haven't always had a great way to deal with them in a long-term sense of getting these people to be independent and live the highest quality of life possible. So it's really important for us as providers to have knowledge of the neurology, to have knowledge of the structure, to have knowledge of the metabolic components that are involved that we're finding out a lot more about too, and really how these systems all can affect each other. And at the end of the day, those give us treatment options and opportunities to help somebody improve their current condition.
Mm-hmm. So, Erik, tell us, how, in your experience, how do patients suffer? You've got the people with acute and chronic headaches, and, how are they treated? How are they similar and different?
Yeah, I mean, there's a lot of similarities and there's also a lot of differences. You know, I'd be dumb to not say, anybody who's in a acute phase or a chronic phase, they're all suffering, they're all in pain. They all have something going on, and their brain is really giving them an indication that something isn't right. To what that is why people come see us and have an examination and all the things that we do as far as our clinical examination to uncover those things. But one of the bigger things, and almost one of the bigger issues with chronic versus acute, is that in an acute state, this is something that's been around for a shorter time than chronic. Intuitively, that makes sense. The problem with that is with a chronic state, we have chronic changes of the brain. And, we're talking and understanding more about this concept of neuroplasticity. Neuroplasticity can be for better, but it can also be for worse.
Right.
And specifically dealing with headaches and migraines and facial pain, the longer you have something, the more your brain has become used to or is adapting to that frequency, for the lack of a better term, of firing of your nervous system. And so with that being said, we will have patients in the office, and there are people out there listening right now who've been suffering for far too long. And with that problem going on, the brain is continuously propagating this pain signal. And the neurons that fire together will wire together to a point, as we're finding out. And it's becoming easier for those nerve fibers to send pain into the brain than it was originally when they started. So when we take that into consideration, there are a couple different factors that we really need to figure out. First of all, what's genuinely causing the headache? People can take Tylenol and painkillers and whatever else you want over the counter or else prescription-wise to get rid of the headache, but that doesn't mean that the actual, injury to insult that's causing those headaches is actually gone. Just because you don't feel pain doesn't mean that specific reason why you're having that in the first place is actually gone. So that's something to consider, because just so you take a headache away doesn't mean that you've took away the actual trigger or signal pushing that headache. The other thing to consider too is that with a lot of these individuals, their headaches are only come on with specific sensory inputs, right? So for classic example, somebody gets a concussion, they get really dizzy or they get lightheaded and they get the headache when they're in like busy visual environments or when they're driving. Well, taking that into consideration, if you deal with car sickness and you just stop driving in cars, your car sickness went away. But the actual reason and the dysfunction that causes your car sickness in the end of the day hasn't changed at all. So people who deal with these chronic headaches really are in an interesting situation because the brain becomes sensitized. And we have to do as much as we can from a practitioner standpoint, but also empowering patients to be able to understand how important it is for personal health and exercises and nutrition and all those aspects to really be able to disrupt that pattern to get them into a situation where they can start healing and improving from those chronic headaches. So there are different camps to look at acute versus chronic. At the end of the day, it's plain and simple. My goal is to improve the quality of life of all my patients, no matter how long they've been suffering. With that comes education. With that comes them understanding, more importantly, owning their own health. And I think once you can pass through that barrier, you have a very high chance of being successful with those conditions.
Hmm. So, what does your exam look like? Like, what are you looking for? What are some of the common reasons that you find people get headaches?
Yeah, good question. Um, there are a multitude of symptoms that can trigger headaches. Going away from the classic chiropractic, even looking at the structure, there are many things in the neck, specifically dealing with trauma, that can trigger headaches. But we also know that there are a significant amount of connections and inputs into the brain dealing with the eyes and the inner ear and these neck inputs all together. And so headaches really are a combination of a multitude of things, like we talked about: neurological status, structural status, and metabolic status. One of the most important things that we do in our office is that we do a bedside neuroexamination. We also do objective testing. And those two systems allow me to really pinpoint and understand what's going on. In a bedside examination, if I have sensitive tissue in the neck, if I have loss of range of motion or orthopedic tests that are positive, I know that there's probably some trigger or something going on in that structural aspect of the neck that's triggering the headaches. If I don't have anything with the neck or with the structure itself, then there's probably not as much information coming from that neck that's leading to the headache. So what else do we have? Well, we have the metabolic system. It's important to look at blood testing, comprehensive bioscreening, looking at kidneys, looking at the liver, looking at thyroid function, full red blood cell, white blood cell count. I mean, all these factors can play a significant role because of the brain and its connection with the gut. And in 2018, 2019 now, we're finding out how important the gut is with regards to brain function. On top of that, too, we know that every human has a set of eyes, right? And neuropsychologists have been using eye tests to look into different components of brain functionality. And we know that the eyes are a window into the brain. With that being said, the objective testing that we do, looking at the ability for your eyes to stay fixed on targets, whether that's static or whether that's you moving in a dynamic setting. Those are really important aspects to give stability to different areas of the brain. Visual tracking is super important. Watching how efficient the eyes can move and if they're hitting targets appropriately. More importantly, putting all that stuff together to get you understand what's going on in your environment. Those are really important factors for understanding, triggers for headaches. More importantly, they're also portals for us to use for treatment, right? So if I find somebody who structurally is not as sound as they could be, there's a great avenue for me to potentially improve the quality of life. If somebody comes in with having an underlying thyroid issue, we see autoimmunity is running rampant, specifically with individuals who suffer from different types of head trauma. Well, why is that? Well, the brain and the gut are so well connected that you have a secondary dysfunction or changes in the gut barriers, the endothelial lining of the gut after head trauma. Now, there's a journal article published in 2009 where they did a study with rats and they induced head trauma to these rats. 6 hours later, they had changes in gut permeability within 6 hours. And so those factors are really important because they cannot be another window into treatment. And on top of that too, using the eyes as a big window into the brain, the eyes can have significant impacts on headaches, and the eyes can have significant impacts on affecting your neck structure as well. So if for those of you who have had a tension style headache, you know that's usually based on the back part of the skull back here. And so I ask that for whoever's watching this right now, I want you to place your fingers actually on the back part of your skull. And I don't want you to move your neck at all, but I want you to move your eyes all over the place. And when you do that, you actually feel your suboccipital musculature contract and relax. This is a super important aspect with this because a lot of people think that if you have neck pain, you have to go after the neck. And a lot of the individuals that make their way into our office don't have neck issues. They've seen a lot of different types of docs, whether it's chiropractors or physical therapists or occupational therapists or myofascial therapists. Well, they've seen a lot of people, right? And so why aren't they better? Well, if you're a hammer, you're looking for a nail. And so everyone is just one confirmation bias away, trying to confirm a finding like that. And a lot of times these people have dysfunction with the eyes, dealing with depth, convergence, tracking, whatever you want, that's actually manifesting as neck pain or headaches. And so I can go after the neck all day, but I'm really missing the moving target, which is the dysfunction of the eyes, which comes down to some sort of brain dysfunction at the end of the day. So putting those together, I mean, you have a lot of gold in that conversation. And it's important to understand all those different facets because they're all relevant, and they're all dependent on each other too, right? You're one person with one body, one mind, one gut. And so with that being said, we have to respect those parameters and own them as practitioners to get patients better even faster than we are today.
Talking about the eyes connected with the neck. And I remember when I first found Jeremy, I mean, I had a lot of whiplash problems going on as well,
Sure.
but it made so much sense. Like I could literally just be sitting at my couch, really comfortable, my neck's propped up,
Mm-hmm.
watching TV, and my neck would still hurt.
Yeah.
And it was because of the eye movements and my eyes weren't working and all that. So that stuff is so fascinating to me, and how there's sort of 101 ways to get a headache,
Yeah.
right?
Yes, I agree. Well, and it's interesting too. A lot of the literature is really pointing us towards using eye movements, using visual tracking, using these kind of motor outputs, for the lack of a better term, for the practitioners out there. What we're really doing in the office is we're giving you some sort of input and seeing what the output is. And with that being said, you are kind of testing different circuits in the house, right? You're looking at, if you flick the light on, which light switch or which light turns on. Okay, great. Well, you know that controls that sector, right? If you turn a light switch on downstairs and the kitchen light doesn't go on, well, of course it doesn't. It's not connected. It doesn't make sense. Now, the brain's complex, and the brain does have a lot of integration with different areas. But for lack of a better term, for a simplistic standpoint, it's all about inputs and outputs. And if those match appropriately, then hopefully those areas of the brain function well. Those suffering with traumatic brain injuries, concussions, vestibular disorders, they're not broken, right? They really aren't broken. A lot of them can still have conversations. A lot of them can still do things. It's just, for the lack of a better term, there are areas of their brain that function like a computer from 2019, and there are other areas of the brain that function like a computer from 1990. And if anyone who was around in 1990 knows, you get 20 minutes to upload AOL online to get one web page up. And that lack of integration, and that lack of capability for those cells or those pools to be able to help do their job is really the limiting factor. They've found cells in the brain and in the body called senescent cells, and so these senescent cells essentially are for poorly worded the weakest link. And those cells really slow down our ability to process information, mitochondrial activation, free radical formation, all those aspects. And so they're really important to understand. And so my goal is to help you update your software, whether that's structurally, neurologically, metabolically, or a combination of all three. And speaking on top of that, 2018 was such a cool year, and we're in the next 5 years are going to be amazing to watch how much information we found out about the gut and about the gut microbiome and about the diversity of these bacterial cells that we are so dependent on, but they're also dependent on us to keep us healthy, digest food, and more importantly, keep our brains active. The amount of time that it takes for you to touch your finger on your face and for you to perceive that same amount of time, that's the same time duration that it takes for you to eat food and have that sensation from that food in your gut lining to go to your brain. We're finding out that the vagus nerve is just like every other nerve in the body as far as giving your brain information. And so with that being said, it's another opportunity to affect specific regions of the brain to help individuals update their software, live higher qualities of life, and hopefully at the end of the day, be able to take care of themselves and become independent. That's always the biggest goal with that. And the gut's going to be a really interesting concept we're going to study for the next 10, 15, 20, probably 100 years, because we're finding out how important it is. And with that being said, too, hopefully we find out more treatments, more opportunities to help more people using those different systems that we kind of took for granted for a while.
Well, with that said, how much does nutrition play into headaches?
Yeah. Nutrition is foundational. I love the quote, "Let food be thy medicine, that my medicine be thy food," right? By Hippocrates. What a brilliant saying. And it was no more truer back then than it is today, especially with all the information coming out about the gut microbiome. They started doing genetic testing and going for the human genome, which turned out to kind of be a little bit of an epic failure for them because they really didn't find everything that they were looking for in that. For the amount of proteins that we create based off the genetics that we have, it didn't match up. And so they're pursuing the human biome project, right? So they're trying to map out all of these different types of bacteria that we house in our guts. And it's really important because those bacteria help us support our immune system. 70% of your immune system is found in your gut. They help produce neurotransmitters. 70% of the serotonin that we all seek, that feel good, happy neurotransmitter we're looking for, 70% of that is produced in your gut too. We know that there's some dopaminergic centers in the gut as well, which is becoming very important for treatment for Parkinson's. The gut is foundational for you, and it really is ground zero for us because that's where we absorb food and nutrients and battle off different types of bacterial infections. I read a study a couple of weeks ago talking about how B lymphocytes actually migrate from the gut into the brain via the vagus nerve and can potentially go into the central part of the brain and start forming plaques relating to MS. And B lymphocytes are just immune cells that we have all throughout our body. But the importance of those is the fact that, it's not just throughout the blood. It's not just throughout, opportunity. We know that these are transferring through the nervous system. So your gut is foundational for you because that's your primary barrier for you to keep the outside world out. And if that's compromised, or if you are eating a poor diet, you're setting yourself up for secondary, tertiary things down the road, which may develop into neurological outcomes. That's what we're finding out with Parkinson's, Alzheimer's. They think it's the new type 3 diabetes, multiple sclerosis. We're finding out more about how important the gut is with these different types of diseases because they're not just neurologically based anymore. They start out metabolically and they manifest neurologically. So it's interesting. And I think nutrition is just such an important topic. We could go on for days talking about different philosophies and camps based off that. But one of the beauties of being able to do functional testing is that you can run blood and assess people's nutritional status. Mm-hmm. And not only is that great for patients, but it's also great for practitioners because it keeps us honest. And it shows maybe you did have changes in your vitamin D status. Maybe you did have changes in your antibody count for your thyroid. Those are important factors for us because we can try and quantify those different levels. And so it's important to show progress. But the important thing is to show that the patients are actually getting better too. So I think it'll be a wild ride for us to kind of see where the gut takes us. And nutrition is so keystone for everything that we do in our lives. There's a reason that, we are coming to the conclusion about how important the gut microbiome is with the foods we eat. So it'll be interesting to kind of see how that pans out.
Mm-hmm. And what about physical activity and physical fitness in relation to headaches? When someone has a headache and a concussion and they don't feel well, it's hard to exercise.
Yeah.
And at the same time, it's this vicious cycle because exercise is so important to help us feel better. So why don't you talk about that just a little bit?
Yeah. Well, I think, and that's a very good point. And with exercise, I think it's important to start out to your own tolerance. Just because you are an individual who has headaches or migraines, by no means saying, you need to push through it and you just got to get over it, because I don't agree with that. But there needs to be some component of movement. There's a reason babies move in the womb. Movement drives brain function. Movement drives so many different circuits of the brain, so many things that we take for granted. Our autonomic system, which helps give us blood flow to our brain, helps control our gut tone, heart rate, blood pressure, digestion, all that stuff is super important. And exercise is just known to be very neurologically beneficial and neuroprotective. So with movement is an important driver of the brain. Movement is a great way for you to activate your brain in different patterns. Those who suffer from headaches, and specifically some of the patients that I have who have concussions, running is difficult for them. Well, exercise doesn't specifically mean to go run a half marathon. Exercise could be just you doing daily household chores, right? I want you moving. I want you doing different activities. The old school thought and mindset for concussions was, put people in the dark room, let them hang out for a while. They'll hopefully recover over time, and then away you go and life goes on. Kind of like the same way what we would do with heart surgery, right? You'd get heart surgery, you'd have an implant placed in, and then they'd keep you bedridden for weeks. Now they want you moving within 10, 15, 20 hours. Yep. Same thing with concussions. We're finding out that activity following concussion or a traumatic brain injury, if the patient's possible to do it, is very beneficial because you are trying to stabilize these areas of the brain that have become unstable due to the trauma. So even though you may be an individual who suffers from headaches, it doesn't necessarily mean that if you aren't swimming or biking or training for triathlon, that you're not benefiting yourself. We just need movement, because that movement drives brain function. That movement will help drive different resources and different avenues for greater endurance in different areas of the brain. Movement, I mean, motion is the way of life, realistically. So if you're not moving, then we're not really activating the brain. If we're not activating the brain, then the brain kind of defaults to this setting where you feel a little bit more pain here and there. Maybe you're a little bit more sympathetic dominant. Things just aren't going to be as efficient for you as they could be. And so motion is such an important component. What motion is a very different conversation for us.
Mm-hmm.
Yeah.
And so, if someone watching is suffering from headaches, what would be your suggestion to them? What should the steps they take be?
Well, I think the first thing is really understanding that you're not stuck. You're not broken. There really is hope for you. I have such a hard time with patients coming into my office and having seen so many different types of practitioners, they're just deflated. They're defeated. Yeah. They think that there's nobody who can help them. And I don't blame them. I really don't. If I'm the 20th, 30th, 40th doctor they've seen, who am I to say that I'm going to change the course of their life? Realistically, I'm not the only person that could ever help these people, but I do feel like I am one of those people that will give them a different thought process. I will critically think through their case, and I'm not afraid to dig deep. I think it takes a team. I really do. I don't think that there's one person out there who can solely do everything on their own. And I don't think there's anyone who's capable of doing it on their own, because there's just so many components to that. And so forming a team, and more importantly, having a good relationship with a provider who genuinely cares and is looking to challenge the status quo and dig as deep as they need to find things that may be potentially propagating, whether it's headache, whether it's dizziness, whatever it's going to be as far as a symptom, is a super important aspect. People don't care how much you know until they know how much you care. And when you bridge that gap and you open that and you provide that opportunity for them to believe in you, you've formed a significant bond. And there's such a significant component of what I do on a daily basis is really forming relationships and then asking those tough questions. We're a team, and there's nothing to be said other than that, because it does take a team effort on both of our parts. I'm going to critically think, and I'm going to challenge, and I'm going to try and keep myself honest with what I see and keep trying to get you to change and improve. But as a patient, you have to do home exercises. You have to watch your diet. You have to prioritize these things that we talk about. And so I think it's really important for patients, if they feel lost or stuck, is first of all to reach out, to have that conversation, whether it's with you, Amy, or whether it's with somebody on the board, or whether it's just with a loved one in general. Have that conversation and open up about it. But second of all, take some proactive steps and start looking for those providers. Have those conversations. Be picky with who you choose to help guide your life, because just because somebody has a doctorate in front of their name, or they have a great webinar, or they have an awesome sales funnel, doesn't mean they're always the best practitioner for you. And that's just being real. A lot of the mishaps that I've found and have covered from with regards to other doctors is just they make assumptions. And we will continuously get burned if we continue to make assumptions. We really have to make observations and then critically think through those. And when we do that, we start finding how to really help people in the short term and in the long term as well too. And I think at the end of the day, my goal as a provider is to put myself out of business, right? I want to get people better as fast as possible, get them living their life, get them out of my office, doing the things that they want to do. Because at the end of the day, if I ever have something go down, I want somebody to put me back together and have that same mentality too. So a team effort will always carry somebody like that. And there are things that I know that other people don't know, and there are things other people know that I'd have no idea about. And so it's important to be able to use that from a provider standpoint too, to keep you honest, to keep you learning new things, and never let you get comfortable with kind of what you choose to do as far as a treatment. So I can't emphasize the team effort enough. I'm grateful to be part of an amazing team. I always tell patients, if they have questions, I have answers. And if I don't have the answers, I'll find somebody who will.
Yeah. And earlier on, you talked about neuroplasticity for good and bad. And I hear so many people who come through your clinic that I meet with, and, they had a 24/7 headache, and I was probably in that same category early on, where you just learn to deal with it. It's just there. I guess I have to learn how to cope with it. And once you get rid of that headache, it's like, oh man, I suffered for 2 years with this, and it's so incredible to get rid of a headache.
Yeah,
And I mean, I had a daily headache, and I would have every couple weeks, I'd have a take me down headache that would last for like 2 days in bed. And I haven't had a take me down headache in probably 6 to 8 months, knock on
it's
wood.
amazing. Yeah. Well, and that's the beauty of the brain, and that is the gift that I get to experience on a daily basis is giving patients their lives back. That is really what it comes down to, whether that's in my office or somewhere else. Patients getting better outside of my office is still amazing, and I love seeing patients just get better in general because that's what we're put on this earth to do, is to treat and help individuals live high quality lives. And sometimes it happens in a day, sometimes it happens in a week, sometimes it's in a
Right.
month. Sometimes it takes a year. Sometimes there are just things that come up and we find out more about what's really going on, and we start, patients are like big onions. You just start pulling back layers and really see what's going on in the background. And although that analogy is a little raw, no pun intended, um, there are a lot of things that can occur and trigger headaches, migraines, facial pain, and any other symptom that we can talk about on this forum. So you have to be willing to do what others haven't been able to do. You have to be willing to question your own biases and beliefs as a practitioner, but also have that conversation with the patient and meet them at their crossroads. Because once you start engaging that team effort and you start asking the hard questions, you're going to have ups and downs just like any relationship. But at the end of the day, if you both have the same goal in mind, you're going to be successful. And I think that you're a testament to that. A lot of the patients that I've been able to help are a testament to that too. And there are a lot of people out there who really want to help these types of individuals. They may be or may not be a part of a team yet. And so finding that team, finding those people who they can refer to and network with and help guide their thought process will allow even more people to get healthy in the long run. So we should always be challenging our own status quo and our own biases. And that's what's great about colleagues is they get to keep you honest too. And patients teach me way more than I can ever teach them. And I'm always grateful for that.
Mhm. Well, this has been awesome. Thank you so much, Dr. Reis, for being here today and just sharing your time and your expertise with us about headaches. We really appreciate it.
Yeah, I'm so excited. I appreciate everything you do, Amy. I think this initiative is amazing. And I'm excited to listen to all the other speakers and presenters because you got an awesome lineup. So thanks for having me.
Awesome. Thank you. And thank you, everyone, for watching. I hope you enjoyed this episode, and we'll see you on the next one.